Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and in this segment we're going to talk about a very important topic of our X-rays. And this is a very beautiful segment where we're going to talk about 100 pediatric X-rays from the respiratory, cardio, CVS, CNS, endocrine, and all other systems. So this is one of the important videos, and you must watch these videos. And for the newcomers, this is the Unacademy NEET PG platform. My name is Dr. Anand, and first of all, Unacademy NEET PG is coming up with a very mind-blowing, a test basically, which is happening on the Jan 23rd at 11 a.m. or from the topics of medicine, dermatology, anesthesia, psychiatry, and basically radiology. 45 questions we will ask you, and 60 minutes you have to answer these questions. And what do you get in return? Nothing. You just get nothing. Only you get 10 lakh rupees. You just get a prize money of 10 lakh rupees, basically scholarships from the Amazon vouchers and multiple other platforms. You get around a rewards of rupees 10 lakhs. Okay. And also for the newcomers, hello everyone, what's up? Hello, where the he kaise ho? How are you doing? And again, for the amazing new people over here in the Unacademy, most importantly, if you buy this 12 months plan, you get 2 months complimentary, and if you get a 24 months plan, you get 4 months complimentary. All you have to use is all you have to do is use a code. I will let you know the code. And also a very good congratulations, a beautiful congratulations to our FMG December 2021 participants. Every single person have worked really hard to earn this platform in their life, and I want you all know, you all people, I want you guys to do your best of the best to do something amazing and become one of the toppers. And also we have this free test calendar, my dear friends. You all know that exam is coming very near, so everyone, I request, participate as much as possible. And we have enormous amount of free test calendar for medical PG. Participate, 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 and participate. All you have to do is use the code. In this if you open the app, they will ask you a code, and you can use this code. It's free of cost. Just unlock the test and start giving it. The code is Dr. Anand. And also we have something known as plus subscription in Unacademy and something known as iconic subscription in Unacademy. In the plus subscription, what do you get? You get all the amazing access to my live and recorded classes. You get to study from the best of the best educators all over the India. You get to participate in all the various quiz, which is important for us to get the best of the best PG marks. This is the plus subscription. And then we have the iconic subscription. In the iconic subscription, you get the Unacademy platform and also the prep ladder subscription, all the clinical notes, video lectures, question bank, rapid revision, treasure notes, everything you get on the iconic subscription. So basically we have two type of subscription. Remember, we have the what you called plus subscription, and we have the iconic subscription. All you have to do is use a code, and in this case this is the code because financially it will be little comfortable for you to buy a big pack, and everyone wants a coupon code somewhere. So this is a coupon code if you want to use it. Time is really less, just one or 2 months left, then you have your amazing mind-blowing exam. Give your best shot. Okay, we're gonna start now. And also at the same time, today is 20th. Tomorrow there is a test of anatomy of our Dr. Mona Lisa. You must be knowing anatomy faculty, Dr. Mona Lisa. She has a test actually coming tomorrow 9 p.m. and again, rank 1, rank 2, rank 3, these small gifts are just to push you to do better in your exams. So 5,000, 3,000, 2,000 Amazon vouchers you'll get if you get this rank 1, 2, 3, and it'll be great, I guess, if you participate tomorrow evening 9 p.m. Again, they will ask a code to you, and you can use this code just to unlock a test. That's it. Okay. Hello Osama, hello Mani Prakash, hello dear Savan, Shubhangi, Chaya, Yogi, and Vaidahi. Very good. So let's start the topic of X-rays. In this segment, I'm going to show you 100 X-rays, 100 most important high yield pediatrics X-rays for MBBS students, for NEET PG students, for NEET SS students also. I'll show you each X-ray. You have to tell me your best diagnosis. It will be in a form of multiple choice questions, so it will be easy to answer. And before starting any amazing segment, we always have this motivating quote, and today's beautiful motivating quote is: being both soft and strong is a combination very few have mastered. Being both soft and strong is a combination very few have mastered. So in your life, you don't have to be always soft, and in your life, you don't have to be always very, very adamant and very, very strong. You need to have a balance. Life is always a bumpy ride. ups and downs and ups and downs. The life is like a bumpy ride. So you also be soft sometime, be strong sometime, be soft sometime, be strong sometime. But having a balance is something very few have mastered. So now you have to check that do you come in that very few, or you still are learning in life. So it's a very beautiful quote which says being both soft and strong is a combination, very few have mastered. Okay, it's a very beautiful quote. Hello Faiz Ibrahim, hello Anand. So let's start this wonderful topic of x-rays. So yes, Pediatrics by Dr. Anand, rapid quiz, 100 x-rays in pediatrics. You will be shown 100 x-rays. You have to choose single best answer. Very simple and smart x-rays we have. Okay, x-ray number 1. This is the x-ray. This, can we appreciate something is happening on the right side? The options are pneumonia, right side pleural effusion, left-sided pleural effusion, or prominent bronchovascular markings. So what is this? What can you see? Anyone? Dr. Kostub? Yes, very good. People are answering very nice. Hello, Dr. Kostub. So can we appreciate like normal lung should be like this, right? But what is this? What is this obliteration of the cardiophrenic and the costophrenic angle? Like this angle. This angle is the cardiophrenic angle. And what is the other angle? This angle is nothing but the costophrenic angle. So can we appreciate that there is a obliteration of the cardiophrenic and a costophrenic angle? Yes or no? And yes, basically fluid. Yes, the best answer for this question is nothing but right-sided pleural effusion. People who have answered right are Vaidahi, Chaya, Anand, Osama, Deepak. Yes, very good, mind blowing. Very beautiful answers you have given. And Savan also, and Ashish Dharwal also. Very good. Okay, now this is now as we go x-ray by x-ray, 100 x-rays are there. So some will be little tough, some will be little easy. So let's see if you can answer. Question number 2. What is this x-ray showing? The options are right-sided consolidation, left-sided consolidation, right-sided pleural effusion, or none of the above. What is this? What is this x-ray? What is this white full patch only? What do you say it? Like, can we say this is a homogeneous opacity? Yes or no? What is homogeneous? What is heterogeneous opacity? So sir, I can appreciate a homogeneous opacity lying over the right, yes, exactly, right side of the lung basically. So this homogeneous opacity is nothing but very important consolidation. It's a right-sided consolidation. Now PG entrance question number 1. Why it's not a collapse? It could be a collapse also, right? Why are you saying it is consolidation? मुझे तो collapse लग रहा है. Savan, हाँ जी, Pancake, I think Pancake is coming, she's on the way. So any Ibrahim, any Akram, Basant, I think it's a collapse, it's not a consolidation. How do you defend my point? That's nice, sir, this looks like a consolidation, sir, this doesn't look like a collapse. Anyone? If there is a collapse, what will happen? Number 1, can we appreciate crowding of ribs? Crowding of ribs. If there was a collapse, there would be crowding of ribs. Point number 1. Point number 2, there will be tracheal shift to the collapsed side. Yes or no? Will there be trachea shifting to the collapsed side? Yes. Will there be crowding of ribs? Yes. And in some cases, mediastinal shift also can be seen. Yes or no? Yes, exactly. So trachea would be shifted, kind of our ribs could be crowded. So this is a typical case of our nothing but right-sided consolidation. Very good. Perfect answer. This Venanti, Faiz, and Pancake. What's up? Kya haal hai? How are you? What's up? Question number 3. Question number 3 is a very beautiful question. I have to zoom little out. Yes, this is the question number 3. Let's see if you can answer. The options are rickets, scurvy, craniotrapes, and trauma. Kya hai ye? This arrow which is there, what is this? Like, what is this extra? What is this extra? Anyone? Ye kya hai? Ye aise kya hai? What is this? What is this, anyone? What is this extra lines? I can't understand. This one. What do you call these things? So some people say rickets and some says scurvy. Line of rickets. Nahi dear Saman, this is nothing but subperiosteal hemorrhage. Subperiosteal hemorrhage. It's a typical case of scurvy. It is a typical case of scurvy. ये जो एरो है ना यहाँ पे ब्रो, एरो, ये जो डॉट डॉट्स हैं, ये फ्रेइंग नहीं है, ये हेमरेज है. कैन यू सी दिस एक्स्ट्रा, दिस सच ऑफ दिस वन फुल, दिस पार्ट एंड दिस पार्ट एंड दिस पार्ट, दिस नथिंग बट हेमरेज. It's like subperiosteal hemorrhage, which is a typical case of scurvy. In rickets, you don't see subperiosteal hemorrhage. In rickets, you will see cupping. You will see like a cup shape. You will see. You will see fraying, right? And you will see widening of wrist. That is in rickets. This is a typical case of subperiosteal hemorrhage. Nothing but a case of scurvy. PG entrance question number 1. How does a scurvy patient present? Anyone? Patient present कैसे करता है? How does a scurvy patient? How can a scurvy patient present? Anyone? Let me. I need this one extra paper. Yes. One second. Yeah. Scurvy. How does a scurvy patient present? 5-year-old baby. A case of scurvy. सावन ने बोला सर एक बच्चा एडमिट किया स्कर्वी का, टिपिकल स्कर्वी लग रहा है मेरे को. मैंने कहा तुमको कैसे पता? ओके राइट, ब्लीडिंग ऑफ गम्स. यस आई एग्री विद यू सर, उसको ब्लीडिंग ऑफ गम्स हो रहा है. वेरी गुड. और कोई इंपॉर्टेंट चीज और देखो, लेट्स सी इफ यू कैन आंसर मी. जॉइंट पेन. ओके यस, जॉइंट पेन. फाइन, वेरी ट्रू, आई एग्री विद यू. जिंजाइवल हेमरेज या ब्लीडिंग ऑफ गम्स, राइट. और कुछ एनीथिंग एल्स? वेरी गुड. वी हैव enormous people who are participating, and the more you participate, the more chances you have, you will definitely clear this exam. Okay, very good. So point number 1, scurvy, which is because of vitamin C deficiency. Most importantly, the scurvy, the pain of the scurvy is so excruciatingly painful that patient can present as a pseudo paralysis of limbs. The patient can present as pseudo paralysis of limbs. Why? Because the pain, the vitamin C deficiency scurvy is so excruciatingly painful that patient refuses to stand, refuses to walk. I feel that it's a case of AFP. What is AFP? Anyone? What is AFP? Yes, exactly. Pancake is right. Pseudo paralysis due to excruciatingly painful. That's very true. The pain is so severe that patient refuses to walk, and I think it's a case of acute flaccid paralysis. What is AFP? AFP is nothing but acute flaccid paralysis. Acute flaccid paralysis is a 20 marks question for a NEET SS students, NEET super speciality students. Can anyone tell me the differential diagnosis of acute flaccid paralysis? For example, a 12-year-old female complains of one full-sided weakness of the one half of the body, not able to move the right upper limb and right lower limb. What are the differential diagnoses of acute flaccid paralysis? Who will tell me? Anyone? What are the differential diagnoses? Yes, definitely. Poliomyelitis is one of the differential diagnoses of acute flaccid paralysis. Very true. Have you heard of Guillain-Barré syndrome? GB syndrome. Have you heard of Guillain-Barré syndrome? Very, very important. Have you heard of transverse myelitis? Have you heard of transverse myelitis? Very important. Have you heard of traumatic neuritis? Have you heard of traumatic neuritis? These are very important questions for the acute flaccid paralysis. When I was working in Lady Harding, there we had a patient of transverse myelitis, So the differential diagnosis, yes, exactly. See, again, the patient comes to you with a weakness, one-sided weakness. You need to understand whether this weakness is ascending weakness or ascending paralysis or descending paralysis. Any differential diagnosis? Can anyone tell me? Mother gives a history that my child's, I would say, all 4 limbs are weak, not able to get up. All 4 limbs are having weakness. Okay, like the power is 1/5 or 2/5. Only flickering is there. You need to ask the mother, right? Is the weakness progressed from upper limb to lower limbs, or the weakness was progressing from lower limb to upper limbs? Yes or no? Because your differential diagnosis is totally different. Can anyone tell me any one important example of descending paralysis and ascending paralysis? Mother gives the history. The patient was having, kind of vocal cord paralysis or respiratory paralysis happened first. Upper limb paralysis happened first, and then the lower limb paralysis. So please, yes, exactly. So Guillain-Barré syndrome basically has a ascending paralysis. Ascending paralysis means the patient will tell that my child was having basically the weakness in the lower limbs, and weakness in the lower limbs progressed to the trunk and then progressed to the upper limbs. Are you you understanding? This is a very important exam question. There are two type of weakness. One is ascending paralysis or descending paralysis. If the weakness was in the lower limbs and slowly progressed to the upper limbs like a ascending one, the important differential diagnosis is Guillain-Barré syndrome, GB syndrome. And very important, remember, D for diphtheria, D for descending. D for diphtheria, D for descending weakness or descending paralysis. The paralysis or the weakness paresis in a case of diphtheria is descending. First upper limbs are involved and then the lower limbs are involved. So it is one example we need to understand. Are you understanding? Yes or no, everyone? What are we studying? We are studying scurvy. Scurvy is because of vitamin C deficiency. I agree the patient can have bleeding of gums, scorbiotic rosary, joint pain, arthritis even the patient can have. But very important, pseudo paralysis of limbs. Number one, the pain of the scurvy is so severe the patient refuses to get up, refuses to walk, refuses to run, and that is why scurvy also becomes a differential diagnosis of acute flaccid paralysis. You only give a ibugesic or a paracetamol. The only you give a ibugesic or a paracetamol, the patient start running. Whereas in a case of Guillain-Barré syndrome, you have to give IVIG or corticosteroids like that. Are you understanding? Are you understanding? Are you using your brains? Yes or no, everyone? Okay, so scurvy patient will have excruciatingly painful pain in the limbs and the whole body. The patient will refuse to walk, and that's why scurvy becomes one of the differential diagnoses of acute flaccid paralysis. And you just give a painkiller, you just give a ibuprofen, you just give a paracetamol, the pain subsides, the next day the patient starts running. That happens in scurvy, but that does not happen in acute flaccid paralysis. Has everyone understood this much? Yes or yes? What do you think? Pancake समझ में आ रहा है? कौस्तुभ, my buddy, okay, the name is my buddy, okay. Osama, hanji everyone, okay, very good, समझ में आ गया ना? And also yeah, and scurvy patient, one extra point I would like to mention here, the scurvy patient, like why I'm mentioning so extra points, whatever point I'm able to remember, because these are exam questions. Scurvy patient, the mother give a typical history, like the exam, see, many of us will be giving next exam, okay. So the examiner will ask you that what is a typical history mother will give you. What is a typical history mother will tell? So mother will tell that while she was changing the clothes of the baby, while she was changing the diaper of the baby, while she was changing the clothes of the baby cries a lot. The baby cries a lot. Why? Because of the excruciatingly pain, because of the vitamin C deficiency. So number one, mother gives a history. The baby cries a lot while changing the clothes. The baby cries a lot while changing the diaper. And the baby cries a lot while taking bath. The baby cries like very badly. The baby cry because the mother will move her limbs and this and that of the baby, and the baby will start crying. This is a very important point, like in general clinical based question if I talk about regarding scurvy. So we should never ever forget this point. Chalo आगे बढ़ते हैं. I'm happy that you guys are getting some good amount of knowledge from me and it's nice. Okay. Pancake says no. बहुत बढ़िया. क्या प्रॉब्लम है? क्या? Why no? बातें करनी है, बातें करें 1 घंटा दुनिया जहान की प्यार मोहब्बत की बातें करें. So this is the very important case of scurvy showing subperiosteal hemorrhage. Question number 4 is very nice. See, these top 100 x-rays are amazing, okay. So you try to participate as much as possible, okay. Hanji, very true. So question number 4, what do you think? The options are rickets, scurvy, craniotapes and trauma. Let me zoom this for you a little bit if you want to see. Yeah, this one. I think now even a blind also can see. What do you think? Is this rickets or is this scurvy? Is this trauma? What is this? What can we appreciate? Anyone? So med buddy, Savan, Staphylococcus vaidehi, pancake. Exactly, pancake is right. Very good, Divakar, perfect. Yes, we can appreciate, we can see a cupping, fraying and splaying appearance. This one, this bone, no, can we see that? This bone, this is nothing but cupping. ये जो ऐसे हो रहा है ना, ये ऐसे. So this is known as cupping, okay, this one. And this part, this, the burnt appearance, this one, this is known as fraying appearance, Fraying, fraying. And the widening of the joint, the widening of the wrist or the joint, that is known as splaying. Very, very important and classical finding of rickets: cupping, fraying and splaying appearance seen in rickets. Okay, this is a typical x-ray of rickets showing cupping, fraying and splaying appearance. Take it done. Okay, let's move further. Question number 4. Question number 5. Very nice question. I love these questions. Okay, we have some million questions to ask you. Savan, answer दे दियो बेटा, वरना जान से मार दूंगा तेरे को अगर reply नहीं करेगा तो. हाँ जी, Mayank Verma. Question number 5. So what do you think, guys? What is question number 5? What is this? Today I will go for running. I'm so happy with my life. Yesterday also I had a nice night duty. Okay, Kaustubh, Staphylococcus, Savan, Mayank, Mani, Julie. Julie, you came late. Why you came late? Okay, yes, it's a typical case of. Okay, गलत आंसर जो दे मैं उसको पकड़ूं पहले, सही तो सबको आता है. ए कोई ए लिख दो गलती से. Very good. So yes, Basant has written A. So dear, remember this is nothing but syndactyly. Have you heard of syndactyly? Can we revise the dactyly? There is something known as syndactyly, something known as polydactyly, something known as brachydactyly, something known as arachnodactyly, and what else? Syndactyly, polydactyly, and yeah, clinodactyly. These dactyly are important. In the X-ray, I can appreciate there is a fusion of the digits. There is a fusion of the digits. So abnormal fusion of the digits is known as syndactyly. What is polydactyly, anyone? So polydactyly, as Julie was present from the beginning. Okay, Julie, that's nice. So polydactyly, anyone is more than 5 fingers, that is polydactyly. What is brachydactyly? Brachydactyly is nothing but short fingers. Short fingers is known as brachydactyly. Any examples of brachydactyly? Any random guesses? So Pancake, any examples of brachydactyly? Exactly. Yeah. So the examples of short fingers of brachydactyly is nothing but short limb dwarfism. Short limb dwarfism, or example is achondroplasia. Achondroplasia. Can anyone tell me, in achondroplasia, upper segment lower segment ratio increases or decreases? What happens in achondroplasia? The upper segment lower segment Pancake, yes, phone was there. Thank you, Pancake, for telling me. Yes, my wife phone was there. She picked up and she went to the other room. Okay, Hanji. Okay, so in achondroplasia, yes, the upper, yes, who said the answer? Yes, Julie is right. The upper segment lower segment ratio increases in a case of achondroplasia. So syndactyly is fusion of digits. Polydactyly is more than 5 fingers. Brachydactyly is short fingers. What is arachnodactyly? Arachnodactyly is long slender fingers. Long slender fingers. One of the important example of long slender fingers is Marfan syndrome. Marfan syndrome. Very good. That's very true. Hanji. Yes, and Marfan syndrome. And what is clinodactyly? Clinodactyly is incurvature of digit. Incurvature of digits, उंगलियों का मुड़ जाना. Incurvature of digits is known as clinodactyly. Very good, perfect, mind-blowing answer. People are answering so beautifully. Very nice. Question number 6. Let's see. Okay, I have to little zoom the question. Okay, question number 6. The options are: the chest X-ray shows oligamic lung fields, the chest X-ray shows plethoric lung fields, the chest X-ray is normal, the chest X-ray shows neither plethoric nor oligamic lung fields. Now what will you answer? क्या जवाब देके आएंगे इस क्वेश्चन का आप? क्या आप छोड़ के आएंगे? फिर जब छोड़ के आके मुझे बताएंगे तब आप मेरे से सुनेंगे, या फिर आप प्यार से इसको करके आएंगे? क्या जवाब देंगे इस क्वेश्चन का आप? Yes, little finger is curved in Down syndrome. I agree with you. Down syndrome में you can see clinodactyly. Yes. हाँ जी. अंडे पे धागा नहीं, मेरे सर पे धागा. This is not अंडे पे धागा. This is nothing but boot shape heart. This is nothing but boot shape heart. Where do you see boot shape heart? It's seen in tetralogy of Fallot. And the important components of tetralogy of Fallot, we all know that: right ventricular hypertrophy, pulmonary stenosis, ventricular septal defect, and overriding of aorta. Overriding of aorta. These are the components. And because of pulmonary stenosis, what happens? There is a decreased pulmonary blood flow, and decreased pulmonary blood flow is known as oligemic lung fields. That is why question number 6, the best answer is option A. This chest X-ray shows oligemic lung fields. Okay, done. I hope you understood. Let's move further. What is this? Anyone? Question number 7. What X-ray can we appreciate? Okay, let's read the whole question. The question is, yes, the chest X-ray shows oligemic lung fields. The chest X-ray shows plethoric lung fields. The chest X-ray, what you called plethoric lung fields in. Okay, Shivani has a question. Plethoric lung fields. Okay, dear, TG of course will have a boot-shaped heart, and tetralogy of Fallot will have a boot-shaped heart, and TGA basically will have a egg-on string appearance. And yes, sometimes it's confusing. It's okay. You'll see a lot of X-ray. You'll get to know. So yes, this X-ray nothing but plethoric lung fields. When lot of blood supply happen. So this is the question number 7. So question number 7, remember, for best answer for this question is nothing but plethoric lung fields. This X-ray, this one, when too much blood flow is there, no, it becomes very whitish. Remember, when less blood is there, please remember, when there is less decreased pulmonary blood flow, the X-ray becomes little black, very extra black when there is decreased pulmonary blood flow. And whenever there is increased pulmonary blood flow, little whitish, all the vessels start protruding and start become very prominent like that. Okay, so that is increased pulmonary blood flow. So it's a case of increased pulmonary blood flow, remember that. Okay, next question. Yes, this is a good one. Question number 8. What is this? If I don't show you the picture, or if I don't show you the options, pancake, what will you answer? Write and come. क्या लग रहा है ये? What is this? ये तुम्हारे दिल का एक्सरे है, ये सावन के दिल का एक्सरे है. What is this? पल्मोनरी हाइपरटेंशन. डियर, पल्मोनरी हाइपरटेंशन बहुत सारी कंडीशन से होता है. पल्मोनरी हाइपरटेंशन डजंट हैव वन सिंगल एक्सरे. पल्मोनरी हाइपरटेंशन इज अ सीक्वल टू many other congenital problems. So what is this? Cardiomegaly. Okay, fine. The options for this are: is it pleural effusion, pericardial effusion, tetralogy of Fallot, or supracardiac TAPVC? What do you think? Okay, Sama says box shaped heart. Okay, Faiz says Epstein anomaly. Someone says water bottle shaped heart. Okay, multiple things are there. Okay, number 1, is it tetralogy of Fallot? Let's just dissect one by one. Is it a tetralogy of Fallot? I don't think so. No, it's not tetralogy of Fallot. Tetralogy is nicely boot shaped heart. Is it supracardiac TAPVC? Is it a case of supracardiac TAVC? No, I don't think so. Supracardiac TAVC will have figure of 8 appearance. Okay, double density is seen, sir. Okay, then what are the options left? So tetralogy of Fallot, no. Supracardiac TAPVC, no. Pleural effusion and pericardial effusion. Of course, the best answer in this case will be pericardial effusion. So this is nothing but a case of pericardial effusion. What kind of X-ray do you see in pericardial effusion? What is the shape of the heart do you see? Exactly. Savan Singh has already told money bag appearance. Money bag appearance, or you can say water bottle shaped heart. Very true, very true. Pancake, full pancake is very right. Money bag appearance or water bottle shaped heart. Very good. Question number 9. So question number 9 is a good one. If you have extra brains, a brainy only can answer this question number 9. These are the two X-rays. One is the lateral view of the skull, and one is some limbs is seen. Now, options are Down syndrome, Beckwith-Whiteman syndrome, Soto's syndrome, or Patau syndrome. Now, who will answer this one? समझ में आ रहा है? I hope you guys are enjoying the class. It's a very beautiful X-rays, like top 100 pediatric X-rays. This is like one of the very awaited class, which is important for everyone. Anyone who is applying for NEET PG. ठीक है? Okay. Yes, so thank God, very good. So the best answer is given by Shivani, Staphylococcus, Pancake, Faiz Ibrahim, and Osama Sheikh. So what can we appreciate? Number 1, in this X-ray, like in this one here, can we appreciate this? This is the tongue, no? This is the tongue, right? Tongue is little big, so we can appreciate macroglossia, That is the one point. Then very importantly, can we see that one side of our limb is long and one side of limb is short? So what is this? This is nothing but, you can say, hemihypertrophy. Hemihypertrophy of limbs, yes or no? So yes, that's why hemihypertrophy of limbs, and you will see this in Beckwith-Weidman syndrome. Slides मैम ने बना के दिए हैं क्या सर? नहीं नहीं ब्रो, स्लाइड्स तो मैंने ही बनाया है, ये मैं ही मेहनत करता हूँ, उसको कोई शौक नहीं है टीचिंग का, मेरे को ही शौक है, मैंने ही बनाया है। और दीपक क्या हाल है, क्या चल रहा है वहाँ पे? कहाँ पे हो अभी? हिमाचल में हो? कहाँ पे हो अभी? आर्मी में हो ना? कहाँ पे अभी? कहाँ ठंड है वहाँ पे? मौसम कैसा है? यहाँ दिल्ली में तो बहुत ठंड है यार, बहुत ठंड है। Yes, very true. Dr. Kostub is right. Osama is right. Yes, you're right. So the number one, we can appreciate hemihypertrophy. We can appreciate macroglossia. So yes, Beckwith-Weidman syndrome is the best answer. So Beckwith-Weidman syndrome. Can anyone tell me Beckwith-Weidman syndrome is associated with which tumor? Beckwith-Weidman syndrome is associated with which tumor? Anyone? अच्छा दीपक, you're quarantine. Okay. फाइन। यहाँ पे भी सर इट्स वेरी कोल्ड। यस डियर, यहाँ भी बहुत ठंड है। शाम को मैं पार्क जाता हूँ, भगवान ये मुझे नानी याद आ जाती है, इतनी ठंड होती है, इतनी ठंड होती है, बहुत ज़्यादा। Yes, Beckwith-Weidman syndrome is associated with Wilms tumor. So Wilms tumor is associated with three important syndromes. One is our Beckwith-Weidman syndrome, Beckwith-Weidman syndrome. Number two is Denny-Drash syndrome, Denny-Drash syndrome, and third one is Wagner syndrome, WAGR. So Beckwith-Weidman syndrome, Denny-Drash syndrome, and Wagner syndrome are the three important syndromes associated with Wilms tumor. And someone is saying about the how is the quality how is air quality in Delhi? That's the very funny question. So it's the air quality in Delhi is very very poor, and we are just surviving and living. So that's only I can say. Okay, we have Gauz Azam. He says, what is Soto syndrome? Anyone? What is Soto syndrome? Can anyone help me out? What happens in Soto syndrome? Have we seen any by mistake any picture of Soto syndrome? Anyone? देखा है Soto syndrome? कहीं भगवान की दया से कोई गलती से देखा हो तो? What happens in Soto syndrome? Number one, if you see the face, number one, the patient will have macrocephaly. The patient will have macrocephaly, flushed cheeks, pointed chin, and the baby will be a big baby. You know, one of the causes for gestational age baby is nothing but Soto syndrome. Yes or no? Yes, very good. Yeah, okay, understood. Yeah, exactly, very true. So one of the causes of large baby or a big baby is nothing but Soto's syndrome. The patient will have macrocephaly, flushed cheeks, pointed chin. These are the important points of Soto syndrome. Okay, remember. Okay, so again we have a motivating quote. 30 minutes are over, 30 minutes are left. So another important motivating quote on the way coming is, I am strong because I have been weak. I am fearless because I have been afraid, and I am wise because I have been foolish. So it's for everyone. Today we all are very very strong because there was a time that we were very very weak, but today we are not weak. I am fearless because I have been afraid. There was a time I was very 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 scared of the future, of the past, of the present, but today I am mind blowing. And also I am wise because I have been foolish. I have been ditched, I have been abused, I have been made fun of, but today I am very very wise. So this is life, today we are strong, today we are fearless, and today we are wise. Okay, done. Very good. Let's move further. Question number 10. Okay, very nice question. Question number 10. So what do you think, anyone? Yes, very true. So what is this picture? Is it unilateral choanal atresia? Is it a nasal polyp? Is it a bilateral choanal atresia? What do you think? Anshuman, Vasudev, Pancake, what do you think? What is the best answer? If I zoom this picture, ये क्या है ये? What is this red arrow? Anyone? What is this red arrow? Yes, very good, very good. So nice, everyone is answering. So very good. So Pancake is right, Osama is right, Julie, Venanti, and Vaidehi. Yes, it's a case of bilateral choanal atresia. I'll give you a chocolate if anyone can tell me how does a patient of choanal atresia present. What is the PG entrance question? How does the question will form? If I am having choanal atresia, what all points I should remember in my mind? Who will tell me? Anyone, anyone, anyone? What are the important points of choanal atresia? कौन बताएगा जल्दी? जबान खोलो अपनी. Savan, what do you think, bro? What are the important points of choanal atresia? Yes, the baby will have distress. Okay, fine. I agree with you. What else? Whatever you guys are saying, I will write that. Okay. I am the examiner. I have to make a PG entrance question on choanal atresia, right? This is the typical picture of choanal. This is my nose, right? This is the nose. This is the nose, and there is a blockage here, and there is a blockage here. It's a choanal atresia. Very importantly, the baby, again, number one, the PG entrance question number one, failure to pass a nasogastric tube. Failure to pass a nasogastric tube and easy to pass a orogastric tube. Yes or no? Can we write this? Yes or no? Exactly. So failure to pass a nasogastric tube and easy to pass a orogastric tube. That is the first point. वेरी इंपॉर्टेंटली अब डिस्ट्रेस बढ़ता कब है और कम कब होता है दैट इज द एग्जाम क्वेश्चन अ बेबी हु इज क्वाइट if the baby is quiet the distress increases. Quiet means if the baby's mouth is closed, the baby's distress increases. Once the baby start crying the distress decreases. The baby feels better after crying. That is the PG entrance question. Exactly. Once the baby cry the baby will become pink. Once the baby stop crying the baby become blue. Why? Anyone? Why the baby feel better after crying? Yes, because once the baby cry he feels better. Why? Because there is a choanal atresia. No, the nose are blocked, right? So once the baby is cry like so once the baby cries he takes a mouth breath, so his cyanosis relieves once the baby cries and take breath from the mouth. Okay, are you understanding? Yes or no? So they are having mouth breathing. PG entrance question number one, failure to pass a nasogastric tube but very easy to pass a orogastric tube. What do you think? Choanal atresia, a baby who is having distress and this and that, but the cyanosis improves on crying. What do you think? The best answer is nothing but choanal atresia. And what's the treatment? The treatment is surgery. Basically we do surgery. Has everyone understood this much? Yes or no? प्लीज पुट अ लाइक बटन इफ यू हैव अंडरस्टूड दिस मच. पहले बताओ मुझे इतना समझ में आया या नहीं आया. And very good. Raghuvansh. Pancake, why are you in a mood of no? Why pancake? What happened? Why are you saying no every time? Okay. Let's move further. Okay. Again, question number 11. This is the x-ray. I will not show you the options. You guys should have a habit of without seeing the option also you should know what are you seeing. Okay, ऑप्शन दिखा दो. ऑप्शन दिखा दो. हम टिक मार देंगे. टिक कोई भी मार देगा. मेरा डॉगी बहुत अच्छा टिक मारता है और ऑस्कर. So yes, Staphylococcus, I agree. Mood swings. So Kostub says, it's supracardiac TAPVC. So Kostub in supracardiac TAPVC, right dear? You don't see this. What is this? What is this? Kostub, ये क्या line क्या है ये? What is this line, Kostub? What are these lines? Anyone? What are these lines? You call it as matchstick appearance. Matches के तीली की तरह होती हैं ये appearance. Matchstick appearance. What are these lines? Anyone? This is nothing but air bronchogram. Number one, this is nothing but air bronchogram, and that is seen in nothing but hyaline membrane disease. So it's a case of HMD. Yes, very true. Vainanti Anand is very right. Tram track appearance, yeah, but tram track appearance is seen in another various nine conditions. You see tram track appearance, but that's separate. So it's a case of hyaline membrane disease, which is also known as respiratory distress syndrome. This ये matches की तीलियां जो हैं, this is nothing but kind of a matchstick appearance seen in nothing but preterm baby. Okay, I have a question here. One more question I want to ask. Which is the most commonest cause? Okay. Which is the most commonest cause of distress in a preterm child, in a term child, and in a post-term child. Three important PG entrance question. Which is the most commonest cause of distress in a term child, in a preterm child, and in a what you call post-term child? Who will answer? Image is not clear, sir. Not clear. अच्छा चलो दोबारा दिखा देता हूँ डियर, एक सेकेंड. सो द मोस्ट कॉमनेस्ट कॉज ऑफ डिस्ट्रेस इन अ प्री टर्म चाइल्ड इज नथिंग बट हाइलिन मेम्ब्रेन डिजीज. The most commonest cause of distress in a term child is transient tachypnea of newborn. Transient tachypnea of newborn. And also the most commonest cause of distress in a term child, who will tell me in a term child? The answer is nothing but meconium aspiration syndrome. Meconium aspiration syndrome. Understood? Yes or no? These are the three important causes. Exactly. Pancake is very, very right. Yes, very true. So most commonest cause of distress in a preterm term. Yes, Deepak is very right. Very true. Okay, I have a question for everyone. If you were not a doctor, which other profession you would have chosen? Which other profession? If you were not a doctor, then which other profession you guys would have chosen? Like someone wanted to be a choreographer or a dancer or a actor or a scientist. If you were given not to choose doctor, or if you have a rewind button in your life, which other profession you would have chosen? So Jasmine says, okay, singer. That's nice. Then we have Gauz Azam. He says IPS के लिए I would have applied. Nice. Okay. Raghuvansh says कभी सोचा ही नहीं. Okay, that's nice. So Anand wanted to be a cricketer. Okay, that's very nice, very good. And what he called Osama, क्या बात है? He wanted to be a politician. That's beautiful, bro. Very nice to hear it. And Savan, okay. Ravi Khan, he wanted to be an advocate. Okay, that's my father and my brother, both are advocates. Okay, and Staphylococcus says he wanted to be a zoologist and also a photographer. Okay, that's nice. That's quite sexy. And okay, our Deepak, he wanted to be in football. That's amazing. Okay. Okay, and we have our Pancake. She says Queen of London. Okay, Pancake, my goodness. Queen of London. Very good. That's nice. And Anshuman Vasudev, he says engineer. Okay, astronautical engineer. Astronautical engineer. Very good. Varun want to be a tech blogger. Yeah, Varun, I think it suits you very well. Tech blogger, you're very good in that. Okay. Okay, take it. That's nice. And okay, Faiz Ibrahim says he wanted to just sleep and sleep. Okay, I think every single see some. So singer, IPS, cricketer, politician, football, advocate, Queen of London, zoologist, and photographer, and aeronautical engineer, and tech blogger. I think everyone. So Shivani Sharma is right. We should bow down to the Queen. Very true, very true, very nice. Good to hear. Very nice, impressive. So this is nothing but a case of air bronchogram. Air bronchogram. So the best answer is air bronchogram. Question number 12. Question number 12 is nothing but, now what is this? This is question number 12. The options are transient tachypnea of newborn, meconium aspiration syndrome, air bronchogram, or hyaline membrane disease. Like if you have to choose one important differential diagnosis, what will you choose? What will you choose? Okay, Raghuvansh says that सबसे अच्छा profession है doctor. That's nice. That's nice. Okay, what I would have chosen? I think I would be, I don't know. I wanted to be a good choreographer actually. I wanted to be a good choreographer. I think I'm very, I can again teaching. I can teach dance very well. I think यहाँ भी वही बात आ गई, teaching only I'm doing. So I think I can be a good choreographer. I wanted to be a choreographer. Like we have this. Have you might have heard of Super Bowl, which is a multinational thing, which Beyonce, Lady Gaga, everyone does that. So they earn money like you have no idea how much. So exactly. Fine. So it's a typical case of nothing but hyaline membrane disease, where we exactly see air bronchogram. It's a typical case of that. Very good. Question number 13. Now let's finish 10 more questions, then we'll chit chat. So question number 13 says, first let me show you the question. I'll zoom little. Okay. The question is, what is there in the arrow? What is this arrow? Okay, I will not show you the options. Okay, Shivani Sharma, what do you think? Yeah, Dr. Kostub, you're right, my dear. What is this? What is this? Question number 13. What is this? ये क्या है? ये क्या है ये? What is this, anyone? Please, can we have the best answer? Forget the options. ये क्या है? What is this? I don't have the options. What is this and what is this? Who will tell me that? Exactly. Julie, this arrow, dear. This arrow. This. ये इतना बड़ा arrow. ये क्या चीज़ है, Julie? This thing, dear. Number 1 and number 2. What is this number 1, Julie? Yes, exactly. Yes, what is this number 1? Okay, yes, perfect. So yes, this is nothing but endotracheal tube. Very good, very good. This is nothing but endotracheal tube. Very right. This one is nothing but the endotracheal tube. And point number 2, what is this? What is the point number 2? This is the nasogastric tube. Very good, very good. This is nothing but the nasogastric tube. These highlighters we must know. The upper one is the endotracheal tube, and this whole thing which is going down is nothing but the nasogastric tube or the NG tube. Very good, perfect answer, mind-blowing answer. Very good. Okay, this is easy. Let me ask you a tough one. Okay, question number 15. Question, I have to take a little zoom out the picture. Question number 15 says, okay, first read the question. The condition shown in the X-ray is seen in which of the following condition? The condition shown in the X-ray is seen in which of the following condition? Like, okay, can anyone tell me what is this X-ray showing? पहले तो बताओ ये है कौन सा एक्सरे. द कंडीशन शोन इन द एक्सरे इज सीन इन विच ऑफ द फॉलोइंग कंडीशन. बट कैन एनीवन टेल मी व्हाट यू कॉल्ड, व्हाट इज द एक्सरे? व्हाट इज द एक्सरे? Okay, pancake says, right, sir, you can be a model. Yes, that's very true. And you know, I was applying for modeling also. That's why I'm having six-pack abs. I wanted to apply for modeling. Many of my friends have told that you look very good in real life and you have a good 6 feet height and a good physique. So why don't you, and you're already settled in your life now. So why don't you apply for modeling? For modeling ke liye, you need to have a good photo shoot. And that photo shoot itself only it costs around 1 to 2 lakh rupees. So I have few of my friends in Delhi who are a good photographer. So I need to have a good photo shoot of mine, and then my photos will be circulated somewhere for a good, ramp walk. So dekho, let's see. Anji. Yes, this is nothing but a whiteout lung. This is nothing but a whiteout lung. Yes or no? So this X-ray is nothing but a whiteout lung. Lung ही नहीं है. Can we see that? There is no lung only. It is a whiteout lung. So where all, question number 15 is where all, in which all conditions do you see whiteout lung? These are the options. So where do you see? Where do you see whiteout lung? So which is the best option, my dear friends? Where do you see whiteout lung? HMD, obstructive TAPVC. Yes. Okay, so Pancake, you are a pro in the photo shoot. ठीक है Pancake, once you come to Delhi, let me know. I'll make 6 packs and let's have a photo shoot. Very good. Hanji, A, B, C, D, E. Exact. The best answer. Still anyone? Yes, the best answer is given by Vaidehi, Osama, Himendra and Dr. Savan. Sabhi mein milta hai, bro. Sabhi mein milta hai. All of the above. It's a very important question. What are the differential diagnoses of whiteout lung? Other than hyaline membrane disease, the differential diagnosis of whiteout lung are infracardiac TAPVC. Infracardiac TAPVC is nothing but obstructive TAPVC. PAP, which is nothing but pulmonary alveolar proteinosis, surfactant protein B deficiency, massive pleural effusion, any group B streptococci infection in newborn. These all are the very, very important differential diagnosis of whiteout lung. And anyone, like sabhi hote hain, dear, sabhi hote hain. When 2 to 3 options are correct, means almost everything is correct, okay? And again, remember, Jasmine, common things are common and rare things are rare. Okay, so if in your next examiner asks you, the first should be hyaline membrane disease, a whiteout lung, surfactant not forming properly, preterm baby, whiteout lung, HMD is the answer. Then cardiac answer is infracardiac TAPVC. Congenital problems is nothing but pulmonary alveolar proteinosis. In pulmonary alveolar proteinosis, there is congenital absence of surfactant. Surfactant is present, but it is not spreaded in my lungs. There's a mutation in the surfactant in pulmonary alveolar proteinosis. So surfactant is not able to spread in my lungs, again giving a whiteout picture. So that you should know. Okay. Question number 16. I am a 29-week newborn. I am a 29 weeks newborn born by LSCS with fetal distress. I also developed tachypnea nasal flaring, subcostal, intercostal retractions immediately after birth. My chest x-ray is attached. Kindly tell me the treatment plan. Kindly tell me the treatment plan. Anyone kindly tell me the treatment plan. The options are nothing but oxygen therapy, surfactant administration and respiratory support, emergency surgical repair for tracheoesophageal fistula, and only observation at this point. So A, B, C, D. What is the treatment plan exactly? Osama Sheikh is right. Treat surfactant. Sir, this patient you only telling no. It's a 29-weeker and born by LSCS, full distress, tachypnea. Why so much of retractions, flaring, and tachypnea is happening? Because lungs are not forming. No, it's a white out lungs. A typical pitch. The lungs are not formed. Normally they should be black, 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 but it's totally white. It's a case of surfactant deficiency, hyaline membrane disease, and in this case, of course, you will give surfactant administration. Very good. Okay, 5 more minutes, then this class is over. अभी 17 क्वेश्चंस हुए हैं. वी हैव 100 MCQs. 100 हर क्लास में पता नहीं इतनी सारी हम क्वेश्चंस करते हैं, हद से ज़्यादा. ओके, क्वेश्चन नंबर 17. I am a 2.5 kg newborn. Okay, I am a 2.5 kg newborn born by term normal vaginal delivery, presented with respiratory distress. Okay, respiratory distress, and who is not responding to surfactant therapy. Now this is another level of MCQ. Okay, yeah, ring in the left, this one. Okay, one second, just see this one. I am a 2.5 kg newborn born by normal vaginal delivery. I've had distress. Okay, and who is not responding to surfactant therapy. My previous sibling also had similar complaints, but she is no more, means she expired. Okay, I will show you my x-ray, and this is my x-ray. What diagnosis comes to your mind? Anyone? What diagnosis comes to my mind? I am a baby who is a, see, normally surfactant deficiency is in preterms, right? Surfactant problem is in someone who is less than 2.5 kg, like a low birth weight, extremely low birth weight, or a preterm baby. But I am a 2.5 kg term baby, 2.5 kg term baby, and I'm having distress. Okay, who is not responding? I'm not getting responded by surfactant therapy. My sister also had the same problem. She also expired, and even she was also given surfactant, but nothing. She also expired. And this is my x-ray attached. What comes to your mind? Question number 17. The options are hyaline membrane disease, Meconium aspiration syndrome, persistent pulmonary hypertension of newborn, or PAP, that is pulmonary alveolar proteinosis. So what do you think? What is the answer? Anyone? Any random guesses? A, B, C, D? Okay, anyone? Any random guesses? A, B, C, D? Okay, so okay, let's go one by one. Hi, HMD. Can this be an HMD? Yes or no? Can this be a hyaline membrane disease? The answer is no, it cannot be a hyaline membrane disease. What are the points favoring? Hyaline membrane disease is in preterm. This is not a preterm. Hyaline membrane disease is less than 2.5 kg. It is not a 2.5 kg. Hyaline membrane disease baby basically gets benefited by surfactant. And here the question is, I was given surfactant, but I was not responded with surfactant therapy. So definitely HMD is out. Okay, HMD is out. Meconium aspiration syndrome. Meconium aspiration syndrome is mostly common in post-dated or post-term baby, more than 42 weeker, more than 42 weeker, or more than 4 kg, right? 2.5 to 4 kg is the normal weight of the newborn. Less than 2.5 kg, the baby will have issues of hyaline membrane disease. More than 4 kg, the baby will have issues of meconium aspiration syndrome. So the points favoring so this is not a meconium aspiration syndrome also, because meconium aspiration syndrome is in post-term babies. This baby is only term. Meconium aspiration syndrome is in more than 4 kg, 4.5, 5 kg baby. This baby is just 2.5 kg. So again, meconium aspiration syndrome is also ruled out. Now please remember, it's not a post-term. True, Savan. Please remember such questions. They are the typical questions which come in exam, and the best answer is pulmonary alveolar proteinosis. Please remember the pulmonary alveolar proteinosis. The highlighters will be, number 1, it will be a term baby. Number 2, not responding to surfactant therapy. That is like very, very important. It's a term baby not responding to the surfactant therapy. And also please remember something known as sibling death. 1 second, I will zoom it and just put it here. कैसे देखूं मैं, 1 second ऊपर लिख देता हूँ. So term baby not responding to surfactant therapy and sibling death, genetic problem. Yes, that means the patient is having some mutation, some kind of mutation in the surfactant, kind of surfactant spread. Mutation in the spread of the surfactant is present in the, but is there in clumps. The surfactant is there in the clumps, it is not getting spreaded. That is why again I gave surfactant to this child. Again the baby did not respond, because this baby is having some mutation where the surfactant, if I give it, no, it doesn't get spreaded. That is why you will see, that is why this is a typical case of, exactly, it's a typical case of nothing but pulmonary alveolar proteinosis. Understood? समझ में आ गया everyone? Yes or no? Question number 18. What is the procedure shown in the image? What is the procedure shown in the image? Okay. So, okay. This one, this. What is this procedure shown in the image? Again, I'll not show you the MCQs. I'll not show you the options. तुम लोगों को बड़ी गंदी आदत है ऑप्शन देखने की. सर ऑप्शन बता दो. Show me option. I will click one very fast, sir. No, sir, there is no option. There is no option. Tell me now. हाँ जी, tell me now. Ring shadow in question 16. देखता हूँ कौन सी ring shadow है. 1 second. अच्छा वो ring shadow नहीं, वो कुछ नहीं है. This nothing. This is nothing. It is just an artifact. It's nothing. It's just an artifact. It's nothing. Okay, it's some ring or some ring like that. It's an artifact. It's nothing. Okay. Question number. Exactly. Yes. So vanilla. Hanji. I have. Staphylococcus says I have one Canon 1300D 18 to 55 millimeter and another Nikon D5600 with 70 to 30 mm and 18 to 55 mm. बहुत बढ़िया. Staphylococcus, I'll send you my house address. You come. Let's do a good photo shoot. Hanji. Shunt in a case of portal hypertension? No, dear. I think Vivek Shrestha has the best answer. What is happening? The question is which procedure is seen? ये कौन कहाँ जा रहा है? क्या है ये? कौन कहाँ जा रहा है? क्या है ये? It's a very beautiful picture. What is this? What is this? What is this? This is nothing but umbilical venous catheter. I am putting a umbilical venous catheter, or you can say umbilical venous line from, this only, from this arrow only going, which is touching the inferior vena cava. Here you have IVC touching the inferior vena cava. Yes, need external flash also, sir. मेरी चेहरा इतना काला है क्या कि तुम्हें external flash भी चाहिए होगा. I have this one. I have this one. Flashlights I have. I have a big that वो जो स्टूडियोज में नहीं होती that marriage studios, no, couple are standing and 2 big flashlights are there. So I have 3 flashlights of 20,000 rupees. If you want, we can use them. Okay, so this is the typical case of umbilical venous catheter. Done. Next, so the best answer was umbilical venous catheter or umbilical vein catheterization. Very good. 2 more minutes, then this class is over. And okay, a good question. Gauss Ibrahim Azam has a good question. What is the, what you called क्या कहते हैं ring light? नहीं, it's a ring worm ही होगा, फिर ring worm हो सकता है. Wait, indication of UVC. Indication of UVC. One of the very important indication of putting a umbilical venous catheter, number 1, if you want to give adrenaline. The best route, the best IV access in a case of neonatal resuscitation protocol. In a case of neonatal resuscitation protocol, the best IV route of access is nothing but the umbilical venous line. The lumen is quite big enough, okay? Compared to the normal peripheral veins, umbilical vein has quite a diameter and it's easy to push drugs from there. So number 1, PG entrance question number 1, how do you give adrenaline? The answer is intravenous. PG entrance question number 2, which is the best route for giving the what you called IV for IV drugs? The answer is umbilical venous line. ठीक है। ओके वेनिला, ऊपर से है लाइट की, ऊपर लाइट की क्या जरूरत है? अच्छा, ओहो, वेनिला की लाइन देखो, नूर ऊपर से है, लाइट की क्या जरूरत है? क्या बात है, थैंक यू वेनिला, दैट्स वेरी काइंड ऑफ यू, दैट्स वेरी स्वीट। ओके, Jasmine says for parental nutrition. Yes, dear, that only. For giving adrenaline, for giving antibiotics in a case of neonatal sepsis. If a baby has a long hospital stay, if the baby has a long hospital stay, then also you will give the what you called you will put the umbilical venous line and you will give the drugs. Okay, done. Okay. That finishes the first half of this program. That finishes कितने questions किए हमने? Let's see. So question number 18. We have only done 18 questions, so it's good enough. Has everyone being benefited with this program, with this 1 hour session? कुछ समझ में आया या नहीं आया? Yes or no? Okay, Jasmine says we can't give calcium gluconate through umbilical line. Yes, in general we avoid giving calcium gluconate through an umbilical line because it can cause thrombosis or necrosis or thrombophlebitis if you give calcium. Yes, can you give fluids to the from the umbilical line? Yes. Can you give antibiotics? Yes. Can you give dopamine, dobutamine, any inotropes, adrenaline through this one? Yes. Yes. All those things you can give. Yes. ठीक है, only calcium is something we avoid, and even some book says blood also, like giving blood also we should avoid from the umbilical line, but some book says that, but again that's for super speciality, we don't have to go till there, it's fine, till उतना दूर जाने की जिंदगी में जरूरत नहीं है. That finishes the 19 questions out of no 19 18. That finishes top 18 questions of the pediatric x-ray, and we are left with 81 more questions. So in the now we have another class at 8:30 p.m. In the 8:30 p.m. class, everyone please come and join the 8:30 class p.m. 8:30 p.m. on this YouTube channel only, and come join next 30-40 MCQs with some 100-200 questions I'll be asking you, and exam is very near, so I want you guys to give your best and best shot. And before leaving, we have this amazing quote which is again Savan had sent me. Thank you Savan, you had sent me this quote. And Savan, the quote is, suffering is not holding you, you are holding the suffering. Suffering is not holding you, you are holding the suffering. You are holding your past, you are holding your future, you are not living in the present. Suffering is not holding you, you are holding the suffering. So please let your past go. Okay, वो कहते हैं ना हिंदी में कि बदलते हुए वक्त को अपनाओ. नहीं, पहले तो बहुत अच्छा था. नहीं, पहले तो आई वॉज वेरी हैप्पी, नाउ आई एम नॉट दैट हैप्पी, यू नो, आई वॉज सो हैप्पी. स्टॉप ऑल दैट. Suffering is not holding you, you are holding the suffering. So this is the morale of the evening quote. Remember, let it go, live, breathe, and move on. Stop regretting, stop thinking about the past, just think about the present, and that is more than enough. Thank you so much everyone for this wonderful, this one, Shrestha everyone. Okay, Jasmine, is it mandatory to give antifungal if we put a UVC? No, there is no indication of giving antifungal fluconazole if you have to put UVC. I have been working in neonatology department from last 1 year, and we don't give, there is no dictum that if I have put a umbilical venous line, then I have to start antifungal or fluconazole. No, nothing like that. Okay, next, any pancakes. So why don't you take this test on the Unacademy app? It's same thing only, dear. Taking the test here or taking the test on Unacademy app. For few days I'll be teaching on YouTube, and then after few days I'll switch on to the Unacademy app. In Unacademy, of course, you can put lot of MCQs poll. I agree with you, but for few days we have to spend few hours on the YouTube channel also. That's why. और कोई सवाल, और कोई मन में सवाल वो तो बताओ, ठीक है. So see you everyone at 8:30 p.m. today on the same YouTube channel, another beautiful 1 hour, and let's cover as much MCQs as possible. So come today 8:30 p.m. Bye. I'm going for a run, and life is beautiful. Stay happy.